Hello and welcome to Bite-Size MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of the MRCP within the last 5 years and want to help you do the same. We're not associated with any MRCP examination organizations, and the materials covered are by no means an exhaustive list of what can come up in your exam, and indeed are not intended to be used as medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is on Clostridium Botulinum under the section of infectious diseases. So this is a picture of Clostridium botulinum. As mentioned previously, it is not a common question to be asked as part of your membership exam for you to identify these type of bacteria based on their histology and under the microscope. However, it is completely within the college's right to ask you these questions based on the slide as part of the MRCP Part 2 written examination. So our recommendation is for you to have a rough idea of what these would look like in terms of their histology to hopefully be able to answer these questions come test day. The epidemiology of it is really quite rare in the developed countries. However, you do get periodic outbreaks which is normally linked to home canning. It is a gram-positive anaerobic rod-shaped bacterium. It produces botulinum toxin, one of the most lethal biological substances. It is commonly found in soil, water, and improperly processed foods. And 7 neurotoxins from A to G subtypes include A, B, E, and occasionally F cause most human botulism cases. It blocks the neurotransmitter release, causing muscle paralysis. The clinical manifestation of it depend on the type, and if it's the foodborne botulism, is normally caused by eating foods that's contaminated with botulism toxin. If it's the wound botulism, it's due to the spores infecting the wound and producing toxins in situ. It can have infant and inhalation botulism, as well as the previous types that was mentioned. The symptoms of foodborne botulism will include nausea, vomiting, abdominal cramps, followed by neurological symptoms. The management of it, really the biggest and the most critical step, is to administer antitoxin as soon as botulism is suspected. The mechanical ventilation may be required, especially if the treatment is delayed, and the patient should ideally be treated and cared for in an intensive care unit. Antibiotics are only recommended for wound botulism, and that would be penicillin. Let's do some questions. A 47-year-old man presents to the emergency department with 24 hours of progressive weakness, double vision, and difficulty swallowing. These symptoms started approximately 36 hours after he consumed a meal consisting of home-canned green beans, smoked fish, and a store-bought potato salad at a family gathering. Given the suspected diagnosis of botulism, which food item most likely contributed to his condition? The options are home-canned green beans, B, smoked fish, C, store-bought potato salad, D, all of the above are equally likely, E, none of the above. If you recall from our slides earlier, you will realize that the home canned products are the most likely to cause botulism if canned inappropriately. Therefore, the correct option is going to be option A. Thanks for listening to this episode of Bite-Size MRCP. If you like what you heard today, give us a thumbs up and hit the like and subscribe button to make sure that you don't miss out on our next episode. Let us know in the comments which topics you would like to hear in the future. See you in the next episode.